So this webinar is entitled Visual Skills for Reading and Learning. And this particular section is part 2, where we're going to talk about a little bit about visual perception. So I am Dr. Valerie Fraser, developmental, behavioral, and neurooptometrist. So why do we need to talk about visual perception and learning? Well, first of all, as you can see, 80% of all learning is visual. And the one thing that we think about usually when we think about vision is mostly visual acuity. People think about eyesight or the ability to see 20/20, but that's really only one out of the 17 visual skills that can impact learning. So we're going to talk a little bit more today about that visual perception, or as I like to call it, visual information processing. So when you look at this picture over on the right, many people right off the bat will not see it as maybe anything. It's maybe like one of those ink blot tests, something like that. Unless you've seen it before, it doesn't have a lot of meaning. But once we put a little bit of form and outline there, you can see there is something there going on. So it's actually a cow coming from the dairy state. Should recognize that. So you can see the eyes and then the ears on the black side there, and then the nose down at the bottom, and then the rest of the body. Once you've kind of gotten that impression or given meaning to this ink blot, so to speak, it's easy to see the cow again when you look at the picture again without the outline, that there is indeed a cow there. So what is vision perception? It's about gaining meaning to what we see. And visual perception has a lot to do with how we process the visual information. So I think this might be the Webster dictionary, but vision perception is the ability to interpret the surrounding environment by processing information that is contained in visible light. So that's a way more than just being able to see 20/20 on an eye chart. One thing I always like to remind people is that it's hard to process the visual information correctly if you don't have very good eye movement and coordination skills. And eyesight as well will go along with that. But most of the time, the eyesight problem is found and fixed. But a lot of my patients have 20/20 vision, but still have trouble with good eye movement and coordination skills. So eye teaming, eye focusing, and eye tracking all need to be working well to get the visual processing to be working correctly. I always say garbage in, garbage out. So if those systems aren't working correctly, it's going to be harder to process the visual information. And I went over what eye teaming, focusing, and tracking are in part 1 of this webinar, Vision and Learning series. And you can find that on our YouTube page. Which visual information processing skills are important for learning? And there's probably more than what I've listed here, but this is what we're going to go over today. We're going to talk about visual directional skills, visual analysis skills, visualization and memory, and we're going to talk about the visual integration skills. Let's start with the visual directional skills. So the terms that we use there are laterality and directionality. So laterality is the internal awareness of direction, understanding right and left on yourself, sidedness of the body, and the ability to identify right and left on yourself. Use the example of hokey pokey, knowing which is your left foot and which one's your right. Directionality is the ability to interpret and project right and left into space and onto others. So that is a little bit different, takes into perspective. So the example of that would be, being able to follow a map. Why is directionality important for reading? Well, one thing that we need to understand is that really it's only in reading where direction, and maybe reading maps, where directionality comes into play. So in our daily life, when we see a wrench, as you see on the left, it's a wrench, no matter if we turn it upside down or turn it sideways, many different angles. That's something that we learn in infancy. It's called form constancy. So we know it's a wrench regardless of which way it's turned. But in reading, there's a certain directional component. So we always have to read left to right, correct? So if we don't understand directional concepts or don't have a firm foundation of that, then it can be difficult because E's and 3's now look the same. And probably the most common, of course, are B's and D's, having trouble telling the difference between the two. And that's because of directionality skills haven't gotten up to a higher developmental level. So how do these skills develop? So during normal development of laterality and directionality, by age 5, we're able to pretty much identify right and left on ourselves. So the majority of 5-year-olds can understand concepts of right and left on themselves. Age 7, we start to learn and understand perspective, so right and left on others. And by age 8 to 9, we are able to identify those onto objects. And by age 11, we expect it to be pretty well established. So these developmental timelines are pretty important when it comes to reading, because many of you may already know that reversals past the age of 8 are a big concern. In fact, I would say between the ages of 6 to 8, you should see a sharp decline in the level of reversals. And you should, if you do have a child who's having trouble with right and left skills, they also may have a lot more trouble following directions. For instance, put your name on the upper left corner. If you don't know right and left, then you might have some trouble with that. Or find your notebook, it's to the right of the milk. You may also notice that kids with laterality, directionality problems will actually be slower readers, and because they have to think longer about, okay, is that a B or a D, P or a Q? And you might notice them reversing not just letters, but also small words such as on and no. Now, some of that can also be related to tracking problems, but laterality, directionality problems are something I would also be concerned about. And then again, this usually comes up a little bit later in life, but those that don't have a good sense of direction often have trouble with navigation, maps, and geography. I think we all pretty much know someone that maybe has difficulty with understanding right and left. So now we're going to get to the more of the visual analysis skills. So visual form and size constancy. So I talked a little bit about form constancy before. It's something that we learn early in life, but sometimes if that isn't quite, even if that skill is not quite well developed, they will have some trouble with recognizing visual information if it's a different size or orientation, or for example, different types of font. So more of an italic font versus a straight printed font, they might have trouble recognizing, okay, that's still an A. So sometimes form and size constancy is a type of analysis skill that children have difficulty with. Another one that come across is visual figure ground. So that's being able to find things in a crowded background and pick out the relevant visual information. So if you can see here, there are some horses in the background here. They're kind of blending in with the background, so they're hard to see. This is one example of maybe a little bit of an extreme visual figure ground problem. But it's important to be able to pick out the relevant information. So, for example, some kids with poor figure ground issues will have trouble finding the juice in the fridge or finding the correct screwdriver. But in relation to reading, it'd be more like scanning and being able to pick out the relevant information, or even track their eyes on the page correctly. And I think I skipped a slide here. So another visual analysis skill that's really important is visual discrimination skills. So that's being able to pick out the details. So you'd be able to notice that certain words, even though they might look similar, have slight differences. For example, the word saw versus the word so. the middle letter is slightly different. The A and the O might look similar, but they have very different meanings. So next we're going to talk about visual memory and visual sequential memory. So visual memory is basically remembering what you saw, being able to recall, identify, and or reproduce an object, image, or feature. And sequential memory is really remembering that visual information when it's presented in a sequence. Why is visual memory so important? Well, as much as we'd like it to be, English is only a partially phonetic language and has many words that can't be broken up phonetically. You know, we tend to call those the sight words. Phonics rules can be really confusing and they aren't always universal. So let me give you an example of that. So for example, if we take the words down below here, though, through, cough, rough, plow, ought. All of these words are still have the same ending, O-U-G-H, or in the last one, beginning, O-U-G-H, but they all have different phonics sounds that go along with them. So though is, if you're going to spell it phonetically, you might use T-H-O, like in the word go. If you add an R, then it becomes through, and then you have to use the oo sound, which if you were going to spell it phonetically, you might think might be, you know, the double O's. Cough is kind of sounds a little bit like off, so maybe you would think cough should be spelled C-O-F-F, and so on and so forth with the next three. So in reading, oftentimes we can use context to understand what that word should sound like as we're reading, but in spelling it's a little different. So we have to be able to create a visual picture of the word and what it should actually be spelled like. And where it also gets confusing, of course, is those words that sound exactly the same but are spelled very differently. So two, and two, there, and there are the common examples of those. So why is visual memory so important? Efficient readers and spellers and writers, like I said, can know the word by sight. They have a visual picture of the word without ever sounding it out. Phonics is important for really tackling new words that we don't know, but you really want to have the visual memory system working well so that you can quickly recognize and recall the word the next time it's seen. A lot of what I talk about when I talk about visual memory is actually visualization. So creating that, going back to that mental picture of what you see. It's also the ability to manipulate that mental picture as well. So poor visualization or making pictures in your head relates to poor visual memory and also will interfere with the ability to understand complex and multi-step processes. Comprehension and visualization go hand in hand, and that includes not just reading comprehension, but also sometimes auditory comprehension. If you don't have a visualization of somewhere of what the person is asking, it'll be harder to implement the task. So visual integration skills. Visual integration skills, I'm going to talk about just briefly visual motor integration and then visual auditory processing. So visual integration, just like it talks about, is about the integrating of two different skills. So in this case, when we talk about visual motor integration, we're talking about the integration of visual information with a motor process. So it could be eye-hand coordination, it could be eye-foot coordination, it could just be just navigating the body as well. Some examples besides just eye-hand coordination would be handwriting or aligning numbers in math. Here's an example of before and after vision therapy and to understand how the visual motor integration process works. So a lot of times, again, if you don't have good visual skills, it will interfere with how you're able to implement that motor coordination. On the left, we have a patient before vision therapy who had to just copy that sentence down below. You can see it took about 2 minutes and 12 seconds, but there were a lot of omissions, so a lot of skipping over words. That was partly due to some eye tracking problems. You can see not on the line, the organization is pretty poor. In vision therapy, a lot of times handwriting will come at the very end of therapy because really we want everything working well. So we need the visual skills, the tracking, the eye teaming and being able to use both eyes together well, and focusing all working well. And then we also need some good visual memory skills, because if you have a hard time remembering the word that you just saw, it'll take you longer, or you'll have to make more eye movements back and forth between the top and where you're writing in order to get the information on the page. So being able to hold on to that visual memory of what you just saw is really important with writing as well. So on the right though, after vision therapy, we can see that this patient did a lot better as far as being able to organize on the page the information. The handwriting's a lot neater. They were able to stay on the lines and not write so big. I see that a lot with problems with eye teaming problems. And then the time took longer, but that's because they didn't skip over so many words. In fact, they didn't make any errors as far as the words go when they copied the sentence after about six months of vision therapy. Here's another example. In the case on the left, it doesn't look too bad, but the spacing is it's still kind of big. That patient did it in about 4 minutes, and then on the right, you can see that there's a lot faster and neater handwriting, and they did it in 2 minutes and 52 seconds there. So a big improvement. And again, these patients, we didn't directly work anything on handwriting. We just worked on the visual skills. We weren't working on motor skills at all, or how they will. We will sometimes work, I guess, a little bit on how they hold the pencil, but for the most part, it all came from their visual skills. And both of these patients were older patients. One was, the second one here was about 9, and the first one there was 12 when they went through vision therapy. Visual auditory integration skills. So that's being able to understand how symbols and sounds can, how symbols can match with sounds. So that would include reading, but it will also include music. It's also the ability to recognize and make a verbal response. So being able to see something and say it quickly. And that also relates to some following verbal directions as well. And I'm not going to say, I guess I'm not going to say a lot about auditory visual integration skills, except for that those are something that seem to get better as patients' visual perception gets better, especially as I talk about like that visual memory as well, is that many patients are able to recognize the words faster and say them faster. There's less of a delay in that process. And then even their overall abilities, like I said, to follow directions gets better. And then when we talk about the diagnosis and treatment of learning-related vision problems, we first need to, of course, identify what the problems are. So part 1 of the series I talked about input problems. Those can be covered by comprehensive exam with tests of eye teaming, tracking, and focusing skills, especially an emphasis on that for any child that's having trouble with learning or reading. And then usually in our office, we will do the second set of testing on a separate day. Usually the second set of testing to work out the visual information processing, we'll want them to be a little bit fresher because we don't want them to be tired as the reason why they may not perform as well. So the visual information processing testing, again, is the second part. So when a child has trouble with vision and learning, we want to make sure that they have good input in part 1, and then we will look at their output or their visual processing in part 2. So treatment. So vision therapy is a progressive individualized program designed to mediate and enhance visual skills and visual information processing. So that's a mouthful. But basically what we're doing with vision therapy is, one, we want to make sure that it's like a physical therapist for the eye. We want to make sure that the eye coordination is there and the tracking is there. But it's also about working with these other areas, like I talked about today, with how they're processing the visual information. So it's very comprehensive in the approach that we take. The more severe the deficits in the visual information processing, it actually requires a longer treatment plan, not only just because we have to address those processing skills, but it also, a lot of what we do in vision therapy involves some type of neurofeedback. And so if they're having trouble identifying what they see, then we will have to take a little bit longer in therapy to be able to get them to a point where they can identify blur, for example. So if they have poor visual discrimination skills, being able to notice a little bit of blur, or what they are able to notice between clear and blurry might take a little bit longer than a patient who doesn't have a lot of visual processing skill difficulty. Some of the testing that we do for visual information processing, in our office at least, include tests of visual perceptual skills. So that could include, that includes all of these tests on the left there: visual discrimination, visual form constancy, visual spatial relations, visual figure ground, visual memory, visual sequential memory, and visual closure. Visual closure is kind of being able to recognize an incomplete picture. So it's a form of visualization. And then we'll also test, we do the Piaget right-left test to look at their level of directional skills, the Gardner reversal execution test, and recognition test. We also look at the test of visual motor integration, and the Wold sentence copy, that was the one that I showed earlier. And then we also do a visual auditory integration test. So if you're not in the area and you're wondering who diagnoses and treats these vision and learning problems, typically it's optometrists with the designation COVD, FCOVD after their name. That means that they're fellows and have done extra coursework and readings and continuing education in the area of vision-related learning problems, including the eye movement skills, developmental vision, visual processing, vision therapy, and strabismus and amblyopia, and also looking at the consequences of brain injury, which often also affects many of the visual perceptual areas. So this FCOVD designation means that they have a certain level of competency. They've gone through some testing and panel review to designate that they've actually basically know their stuff. So that's what that's about. And so typically those are the doctors that tend to specialize and treat these problems. And then finally, if you're looking for ways to work on visual processing skills at home, we recently did a blog post that looked at, went over some of the visual skills areas that I just talked about, and give some ideas of some fun games. I think games are a great way to learn some of those visual processing skills. So there's some recommendations in this blog about some games that you can easily get through. I think a lot of them are available on Amazon or Target. I have some as well. So thank you. So if you have any other questions, you can feel free to contact us at info@newhorizonsvision.com. I'm going to open it up to questions now.
So